Good afternoon, everyone. My name is Kenia Reed.
My name is Jenna Thomas.
My name is Sophia Roberts.
And the topic of our Health Disparities Project is higher HIV rates in poverty-stricken urban areas.
So what is HIV? HIV is a human immunodeficiency virus that destroys the type of white blood cell that aids the body in fighting different infections. Destroying this blood cell helps leave the body open to more infections and diseases. This can later on cause a disease known as acquired immunodeficiency syndrome, which many may know as AIDS. AIDS is the final stage of infection within HIV. This is because it occurs when the body's immune system is severely damaged because of HIV. However, not everyone with HIV will in fact develop AIDS.
There are two types of symptoms associated with HIV. They are acute symptoms and severe symptoms. Acute symptoms occur when HIV is in the early stages and it's just starting to progress. These symptoms include fever, chills, mouth ulcers, swollen lymph nodes, which are mainly on the neck, and muscle aches. Severe symptoms are when HIV has progressed to the point of becoming AIDS. Symptoms for that include pneumonia, rapid weight loss, and prolonged swelling within the lymph nodes.
Causes and transmissions of HIV. HIV is caused by the HIV virus and spread by the transmission of the disease from individual to individual. The first way of transmission can be through unprotected sex with an infected partner, and the second can be sharing contaminated and infected needles. There's also another type of transmission, such as vertical transmission. Vertical transmission is a transfer of a disease from a mother to her child during pregnancy, childbirth, or breastfeeding. Breastfeeding is a form of vertical transmission because breast milk is a fluid transfer from the mother to her child that can contain HIV, which results in the child contracting HIV. Risk factors. Risk of HIV can include having an STD. An STD is a sexually transmitted disease that is transmitted through sexual contact, which increases your risk of contracting HIV in the future. People who are involved in risky sexual behaviors can also be a risk factor too. These include not using protection such as condoms when participating in sexual intercourse, not having regular checkups with your doctor, having multiple sex partners, and not taking appropriate medications. Another risk factor can be income, education, and geographic region. Those who have lower incomes are less likely to afford healthcare, which can make it harder for them to screen for HIV or receive checkups to help manage or prevent HIV. Lacking education on the dangers of HIV can also put people at risk for obtaining the disease, because they may be unaware of what HIV is and how it's transmitted. Also, based on where the individual lives, there may be higher rates of HIV, which puts them at a risk for contracting it. Lastly, not having proper access to healthcare in certain regions is another risk factor itself.
Though HIV isn't curable, there are methods to provide people that have the disease some relief. One way of doing that is through antiretroviral therapy. This therapy will have patients on multiple medications, which will multiply the amount of the necessary enzymes within the body to reduce the viral load of HIV. This treatment helps because it suppresses the replication of HIV cells within the body. The multiple medications target multiple stages of HIV cycle and allow room for CD4 cells to recover and reproduce. It is important to clarify that this treatment does not cure the virus, but it helps control it and allows individuals living with HIV to have longer and healthier lives. Another way to help quote-unquote treat HIV is with a medication called PrEP. PrEP stands for pre-exposure prophylaxis, which is prescribed to people when HIV is first detected in the body and helps reduce the risk of HIV. When taking PrEP from the pill, it reduces the risk of HIV from sex by 99% and reduces the risk of HIV from injections by 74%.
So now we move on to the stages of HIV infection. So first, HIV attaches to the CD4 molecule and CCR5 coreceptor on a T helper lymphocyte. It then fuses with the cell membrane, entering the cell. Once inside, the virus integrates into the host genome, forming a provirus. Reverse transcription and viral mRNA production follow. Reverse transcription is when the virus's genes recode the human genetic material from RNA to DNA, where RNA is like a message in one language and reverse transcription translated into another language, which is DNA. This leads to the creation and assembly of HIV structural proteins within the host cell because they become a permanent part of DNA, which allows HIV to hide. Finally, millions of HIV particles are released through viral budding, which is capable of infecting other cells. So, continuing on with the pathophysiology, there are complications. With complications, there are opportunistic infections. This refers to infections that occur in individuals with weakened immune systems. HIV weakens the immune system, making individuals more susceptible to opportunistic infections such as pneumocystis pneumonia, which is a fungal infection that affects the lungs and can cause severe respiratory symptoms. Secondly, are AIDS-defining illnesses. So as HIV progresses, it can lead to acquired immunodeficiency syndrome, as previously stated. AIDS is diagnosed when a person with HIV develops certain opportunistic infections or when their CD4 cell count falls below a certain level. Furthermore is the prognosis of HIV. So prognosis is the prediction of the course of a disease. A patient with HIV and a CD4 count greater than 500 has the same life expectancy as someone without HIV. Additionally, a person with untreated AIDS has a life expectancy of about 1 to 2 years after the first opportunistic infection. Still, determining the prognosis depends on timely diagnosis and treatment, consistently taking the treatment, immune health, and access to healthcare because these help to determine how the disease may progress. There are also future therapies surrounding HIV. The first form of future therapy is shock and kill. This form of therapy seeks to find reservoirs of HIV viruses that may exist but are inactive in our cells. When shock and kill activates the latent HIV, antiretroviral therapy will be able to identify them and kill them. The goal is to eliminate the reservoir, which is the storehouse of dormant HIV cells. Secondly is gene editing. So with gene editing, the CCR5 gene, which encodes a protein on immune cells, makes around 1% of the global population immune to HIV. This mutation prevents HIV from binding to cells and infecting them due to a missing CCR5 protein. Introducing this mutation to our DNA could theoretically provide HIV resistance if it can be provided to more than 1% of the population. Throughout this presentation, we have been mentioning CD4 cells, but what are CD4 cells? So, as mentioned, CD4 cells play an integral role in the immune system which HIV attacks. HIV destroys CD4 T cells, which are white blood cells that play a large role in helping our bodies fight diseases. CD4 cells do so by recognizing foreign substances and activating other immune cells to attack and eliminate them. The fewer CD4 T cells you have, the weaker your immune system becomes. And in terms of HIV, you can have an HIV infection with few or no symptoms for years before it turns into AIDS. And so antiretroviral therapy is used to suppress HIV replication and preserve and increase CD4 cell counts within the body to help fight the disease.
This is an overview of HIV from molecular to organismal level. At the chemical level, HIV duplicates itself, causing an imbalance of various chemicals and molecules in the body, resulting in immune system dysfunction. At the cellular level, HIV mainly targets and infects CD4 cells. It enters the cells and duplicates and destroys them. This weakens the immune system and affects its ability to fight the disease. As HIV replicates and destroys CD4 T cells, it leads to inflammation and damage in various tissues, particularly in lymphoid tissues, which is a type of connective tissue. Organs that have this tissue include lymph nodes and spleen. This can result in swelling, pain, and dysfunction of these tissues. At the organ level, HIV can cause damage to specific organs, such as the brain, lungs, liver, and kidneys. This damage can lead to various complications and diseases, including neurological disorders, respiratory problems, liver dysfunction, and kidney failure. HIV primarily affects the immune system, making it hard to fight infections and diseases. By spreading infections through the immune system, other organ systems can also be infected. At the organismal level, HIV can progress to AIDS if left untreated. The immune system is severely compromised at this point, making the body vulnerable to infections, cancers, and other complications. Organ failure and death can also result at this level.
HIV is a disparity due to it being a larger issue within certain groups of people. These groups include people that fall under racist, sexist, homophobic, and transphobic views, as these can affect their access to healthcare, education, and employment. For example, men who have sex with other men are accounted for 71% of new HIV diagnoses within the United States as of 2021, while those who have acquired HIV through heterosexual contact are only accounted for 15% of new diagnoses. There is a clear gap between these two groups, showing how HIV greatly affects one group more than another. Also, HIV-related stigma and discrimination can create barriers to HIV prevention testing and treatment. This is especially the case in marginalized communities, where individuals are more likely to face discrimination and less likely to have access to resources and support. This can lead to a higher risk of infection, as these individuals may not be aware of their own HIV status or unable to access testing and treatment. In all, HIV is a disparity because it disproportionately affects certain populations based on various factors, leading to the unequal rates of infection, access to care, and health outcomes.
So how does socioeconomic status relate to HIV? Well, in a study which consisted of 762 individuals in the St. Louis metropolitan area, it showed the relationship between neighborhood conditions and HIV management, as well as engagement in high-risk behaviors. So the study observed that having more accessibility in areas such as urban areas, to alcohol equated to high-risk behaviors like unplanned and unprotected sex, which allows for easier HIV transmission. Unemployment also contributes to poor HIV management because many individuals in these neighborhoods that contract the disease lack financial security and cannot afford HIV prevention and or treatment. So because they cannot treat the disease can worsen and progress to AIDS. So some statistics found from the study were that individuals that were included in the study, 67.2% of them were male, 74.3% were African American, 52.4% were unemployed, 52.6% had an annual income of less than $10,000, and 81% of these people who fall under these categories had less than 200 CD4 cells per microliter, which indicates that they have AIDS. This data suggests that individuals in these demographics are disproportionately affected by HIV, where the majority are male, African American, unemployed, and have more advanced HIV.
HIV tends to be more prevalent in urban areas. For example, states such as South Florida have a higher rate of HIV. In a study done, it showed that more men were diagnosed with HIV with 79.7%, whereas women were less, with 20.3%. Of those people who were diagnosed, Black and Hispanic people were more likely to have the diagnosis. Among everyone from the study, the age in which most diagnoses were between the ages of 25 and 34. The study showed that in these areas there is an increased sexual activity because people in these racial and age groups are more likely to be sexually active with multiple partners, which increases the risk of being infected with HIV. Additionally, Black and Hispanic people have been shown to have lower incomes, which may affect their ability to access and afford testing and treatment for HIV. As a result, these communities are more likely to experience higher rates of HIV infection, which presents a disparity.
Urban areas, lower income, and HIV. According to the graph, out of the states in the U.S., HIV disparities tend to be a lot higher in southern urban areas. In these areas, residential instability tends to also be a lot higher. Residential instability increases economic poverty. The result is a worsening of health conditions which can cause increased risky sexual behaviors. Consequently, HIV rates increase in these areas.
We know that those who live in urban areas and have lower income are affected by HIV, but what about those who live in those same urban areas but have a higher income? How does HIV affect them? So, there was a study done that compared the correlation between income and HIV prevalence. Those who have an income of less than $10,000 annually were shown to have a higher HIV prevalence as opposed to those who make even more. Those that made $50,000 per year or more had the least HIV prevalence rate. As shown, as the amount made annually increases, the prevalence of HIV decreases. This is because as income increases, people are more likely to have access to healthcare, which can help them get tested and get treated for HIV. Additionally, higher incomes mean people are more likely to have access to HIV prevention methods, such as condoms, which can help avoid contracting the virus in the first place. A luxury like this is out of reach for those whose income isn't nearly as high.
Based on the data that we have observed, we were able to develop the hypothesis that due to the lack of resources, financial hindrance, individuals with a lower socioeconomic status that live in urban areas suffer from higher HIV rates.
Mobile health clinics play an important role in providing urgent care, screenings to prevent disease, and managing chronic conditions. It is through direct engagement with communities and leveraging existing assets that these clinics are able to provide affordable, high-impact health care that responds dynamically to changing needs in the community. The mobile health clinics will provide free HIV, ART, and PrEP treatment, as well as testing for other STIs. This will bring the resources to the lower-income communities, which will make HIV prevention and treatment methods easier and more cost-effective for these disadvantaged communities. In the statistics shown, there was a study comparing a mobile health clinic to a traditional clinic in Baltimore, and the results found that the percentage of clients who agreed to undergo HIV screening was higher at the mobile health clinics, with 54.4% in mobile health clinics versus 7.1% in the traditional clinic. This is a significant gap, which highlights how more people were willing to go to the mobile health clinic instead of a traditional clinic because it provided easier access. Also, this is likely due to the fact that mobile health clinics are more likely to provide clients with more personalized counseling and support, which can make them feel more comfortable accepting HIV testing as opposed to a traditional clinic. Also, the percentage of HIV tests that turned out positive was higher at the mobile health clinic than it was at the traditional clinic, with 5.4% being at the mobile health clinic versus 2% at the traditional clinic. This shows that the mobile health clinics were able to retrieve more positive results of HIV than the traditional clinic was. This indicates that the mobile health clinics facilitate more HIV screenings and are more efficient at reaching high-risk populations. This shows that having mobile health clinics to address the issue of HIV can be a successful intervention.
It is common for people to overlook certain aspects of their health, but when they are made aware of them, they become more conscious and self-reflective of their habits to take necessary precautions. At CC&J, offering free services such as HIV tests at the school can encourage students to get tested. It is more affordable, and if tested positive, they will be able to form a course of action for treatment options. Similarly to CC&J's initiative, partnering with these local areas within lower-income communities is another method of bringing them resources. By reaching out and partnering with various nonprofit HIV organizations, they can supply local areas with necessary resources needed for HIV management. In local areas, services would include free blood tests and screening for HIV. Additionally, in support of limiting risky behaviors, these centers can also provide information on HIV management and give free contraceptives such as condoms. Another resource would be counseling and support groups, which can take place at schools when they are vacant. The purpose of support groups would be to provide a safe space for those who have HIV to interact with one another and develop emotional support. This is especially beneficial considering stigmas that surround HIV that make it hard for people to share their experiences because of the fear of being judged. On the other hand, counseling groups will educate by providing professional guidance to help them cope with aspects of living with HIV from a therapeutic approach.
And so, to test the efficacy of the proposed interventions, they will begin in the poor southern urban communities. There is an uneven distribution of HIV diagnoses across regions, as according to the image shown. Of all newly diagnosed HIV patients in 2021, 52% lived in the South, 21% lived in the West, 14% lived in the Northeast, and in the Midwest. The South will be the target population because it consists of the largest population of those affected by the disease. After enacting these interventions and taking a new census, if there's a significant decrease in the amount of people diagnosed with HIV in the South in the near future, then we would know that the methods are effective.